Video 2 outlined the Health Professions Act and the functions and key documents that guide the work of a regulatory college, such as the CLPNA. In addition to what has already been discussed, a regulatory college's responsibilities include setting education, registration, and annual renewal requirements, maintaining a public database identifying the registration status of its registrants, setting continuing competence requirements, providing information about practice, expected professional standards, and guidelines that support public safety, setting and enforcing practice, conduct, and ethical standards for the delivery of professional services, ensuring compliance with healthcare legislation and regulation, and investigating concerns regarding questionable conduct of its registrants. The Health Professions Act provides a common framework for all regulated health professions, with 9 parts a regulatory college must abide by. The following 5 parts will be reviewed in this video. Part 1, Governance. Part 2, Registration. Part 3, Continuing Competence. Part 4, Professional Conduct. And Part 8, Regulations, Bylaws, Code of Ethics, and Standards of Practice. The governance of a regulatory college is overseen by a council, comprised of regulated members of the profession and members of the public. The council is responsible for setting the college's strategic direction, evaluating college administration and operations, establishing, maintaining, and monitoring policies which govern the profession, including bylaws, standards of practice, and code of ethics, approving educational programs, reviewing and monitoring fiscal policies and statements for financial health of the college, and hearing appeals on matters of conduct or registration. A primary function of a regulatory college is to maintain a register, an official record of its registrants who provide professional services. Registration involves the assessment of an applicant to determine if they meet the requirements to become a regulated member of the profession. Some of the requirements for registration include evidence of meeting the requirements for competence. This is most commonly done through the successful completion of a program of study. Evidence of having good character and reputation, including a criminal record check. Evidence of meeting the requirements of English language proficiency and payment of an application fee. The required documents for registration submitted by an applicant are reviewed by the college. Then a decision is made whether to issue a practice permit, defer the decision until a certain requirement is met, or to deny the application. When a practice permit is issued, the registrant is required to renew that practice permit annually. In addition, there are some requirements for renewal that are expected to maintain a practice permit. These can include meeting the requirements of the Continuing Competence Program, providing declaration of good character and fitness to practice, and paying renewal fees. A practice permit ensures that registrants continue to meet the requirements for registration in Alberta. A regulatory college is required to establish a mandatory continuing competence program. A continuing competence program provides a framework to ensure that registrants are continually learning and enhancing their knowledge, skills, and ability to provide safe practice. The college is required to audit a registrant's continuing competence learning. This process involves a review of a registrant's compliance with the program. A random selection of registrants are chosen to participate each year. The audit is completed by the competence committee that is appointed by the college's council. A regulatory college, through processes outlined in the HPA, provides the public a way to submit formal complaints against a healthcare provider for unsafe, unskilled, and unethical practice. Any individual can submit a formal complaint to a regulatory college. The complaint is required to be submitted to a college in writing, signed, and dated. Anonymous complaints are not accepted. The complaints director of a college may also lodge a complaint if a registrant's practice is in question. Examples of unprofessional conduct include, but are not limited to, practice and competency concerns, patient neglect or abuse, sexual abuse or sexual misconduct, abandonment of care, medication errors, patient safety concerns, breach of privacy and confidentiality, theft, fraud, or deceit, boundary violations, and coworker harassment and bullying. When a formal complaint is received, the matter will be investigated. Once a written investigation report is received, the complaints director will review the report to determine if there is enough proof to support unprofessional conduct. A decision is made for every complaint received following the guidelines of the HPA. Regulations, bylaws, standards of practice, and a code of ethics outline the requirements and expected behaviors of a regulated profession. Regulations are made for a profession following approval by Alberta Health. The development of regulations generally involves extensive consultation with stakeholders. Colleges and councils develop bylaws to undertake their responsibilities on a day-to-day basis under the Health Professions Act. And a college must establish, maintain, and enforce a code of ethics and standards of practice for the profession. This video provides a high-level understanding of the role of a regulatory college in providing public protection through registration, continuing competence, and the complaints process. As well, you should have a better understanding of some of the requirements as healthcare aides prepare to become a regulated profession in Alberta. Updates on the HCA regulation are available online at hcaregulation.com.